Question 1. What is dental amalgam? Silver fillings. Answer. Most people recognize dental amalgams as silver fillings. Dental amalgam is a mixture of mercury, silver, tin and copper. Mercury, which makes up about 50% of the compound, is used to bind the metals together and to provide a strong, hard, durable filling. After years of research, mercury has been found to be the only element that will bind these metals together in such a way that can be easily manipulated into a tooth cavity. Question 2. Is mercury in dental amalgam safe? Answer. Mercury in dental amalgam is not poisonous. When mercury is combined with other materials in dental amalgam, its chemical nature changes, so it is essentially harmless. The amount of mercury released in the mouth under the pressure of chewing and grinding is extremely small and no cause for alarm. In fact, it is less than what patients are exposed to in food, air and water. Ongoing scientific studies conducted over the past 100 years continue to prove that amalgam is not harmful. Claims of diseases caused by mercury in amalgam are anecdotal, as are claims of miraculous cures achieved by removing amalgam. These claims have not been proven scientifically. Question 3. Why do dentists use dental amalgam? Answer. Dental amalgam has withstood the test of time, which is why it is the material of choice. It has a 150-year proven track record and is still one of the safest, durable and least expensive materials used to fill a cavity. It is estimated that more than 1 billion amalgam restorations fillings are placed annually. Dentists use dental amalgam because it is easier to work with than other alternatives. Some patients prefer dental amalgam to other alternatives because of its safety, cost-effectiveness and ability to be placed in the tooth cavity quickly. Question 4. Why don't dentists use alternatives to amalgam? Answer. Alternatives to amalgam, such as cast gold restorations, porcelain and composite resins, are more costly. Gold and porcelain restorations take longer to make and can require 2 dental appointments. Composite resins or white fillings are aesthetically appealing but require a longer time to place the restoration. It should also be known that these materials, with the exception of gold, are not as durable as amalgam. Question 5. What about patients allergic to mercury? Answer. The incidence of allergy to mercury is far less than 1% of the population. People suspected of having an allergy to mercury should be tested by qualified physicians and, when necessary, seek appropriate alternatives. Should patients have amalgam removed? No. To do so without need would result in unnecessary expense and potential injury to teeth. Question 6. Are dental staff occupationally exposed? Answer. Dentists use premixed capsules, which reduce the chance of mercury spills, and newer, more advanced dental amalgams are containing smaller amounts of mercury than before. An interesting factor can be brought into this. Because dental staffs are exposed to mercury more often, one would expect dental personnel to have higher rates of neurological diseases such as multiple sclerosis. They, in fact, do not. Question 7. What are other sources of mercury? Answer. Mercury can be found in air, food and water. We are exposed to higher levels of mercury from these sources than from a mouthful of amalgam. Question 8. What is tooth decay? Answer. Tooth decay, also known as caries or cavities, is an oral disease that affects many people. Unlike other diseases, however, caries is not life-threatening and is highly preventable, though it affects most people to some degree during their lifetime. Natural bacteria live in your mouth and form plaque. The plaque interacts with deposits left on your teeth from sugary and starchy foods and produces acids. These acids damage tooth enamel over time by dissolving or demineralizing enamel, which weakens the teeth and leads to tooth decay. Foods containing carbohydrates, starches and sugars such as soda pop, candy, ice cream, milk and cake, and even some fruits, vegetables and juices may contribute to tooth decay. Question 9. How are cavities prevented? Answer. The acids formed by plaque can be counteracted simply by saliva in your mouth, which acts as a buffer and remineralizing agent. Dentists often recommend chewing sugarless gum to stimulate your flow of saliva. However, though it is the body's natural defense against cavities, saliva alone is not sufficient to combat tooth decay. The best way to prevent cavities is to brush and floss regularly to rebuild the early damage caused by plaque bacteria. We use fluoride, a natural substance that helps to remineralize the tooth structure. Fluoride is added to toothpaste to fight cavities. The most common source of fluoride is in the water we drink. Fluoride is added to most community water supplies and to many bottled and canned beverages. If you are at medium to high risk for cavities, your dentist may recommend special high concentration fluoride gels, mouth rinses or dietary fluoride supplements. Your dentist may also use professional strength anti-cavity varnish or sealants, thin plastic coatings that provide an extra barrier against food and debris. Question 10. Who is at risk for cavities? Answer: because we all carry bacteria in our mouths. Everyone is at risk for cavities. Those with a diet high in carbohydrates and sugary foods and those who live in communities without fluoridated water are likely candidates for cavities. And because the area around a restored portion of a tooth is a good breeding ground for bacteria, those with a lot of fillings have a higher chance of developing tooth decay. Children and senior citizens are the two groups at highest risk for cavities. Question 11. What are the ways to prevent cavities? Answer: 3 ways to prevent cavities. Cut down on sweets and between meal snacks. Remember, it's these sugary and starchy treats that put your teeth at extra risk. Some research says certain foods such as peanuts or sugar-free chewing gum may be friendly to teeth. Eating these foods along with or after foods that contain carbohydrates may help to counter the effects of acids produced by bacteria. Drinking plenty of water can help wash away food particles. Of course, dentists encourage their patients to eschew these sugary snacks in favor of healthy alternatives. Brush after every meal and floss daily. Cavities most often begin in hard-to-clean areas between teeth and in the fissures and pits, the edges in the tooth crown and gaps between teeth. Hold the toothbrush at a 45-degree angle and brush inside, outside and between your teeth and on the top of your tongue. Be sure the bristles are firm, not bent, and replace the toothbrush after a few weeks to safeguard against infecting your mouth with old bacteria that can collect on the brush. Only buy toothpastes and rinses that contain fluoride. Antiseptic rinses also help remove plaque and that bear the American Dental Association seal on the package. Children under age 6 should only use a small pea-sized dab of toothpaste on the brush and should spit out as much as possible because a child's developing teeth are sensitive to higher fluoride levels. Finally, BECA, use caries, is a transmittable disease. Toothbrushes should never be shared, especially with your children. See your dentist at least every 6 months for checkups and professional cleanings. Because cavities can be difficult to detect, a thorough dental examination is very important. If you get a painful toothache, if your teeth are very sensitive to hot or cold foods, or if you notice signs of decay like white spots, tooth discolorations or cavities, make an appointment right away. The longer you wait to treat infected teeth, the more intensive and lengthy the treatment will be. Left neglected, cavities can lead to root canal infection, permanent deterioration of decayed tooth substance and even loss of the tooth itself. Question 12. What's involved in bleaching? Answer. First, the dentist will determine whether you are a candidate for tooth bleaching and what type of bleaching system would provide the best results. If you're in a hurry for whiter teeth, you may decide to have your teeth lightened immediately. Your dentist will use either an in-office bleaching system or laser bleaching while you sit in the dental chair. Some patients choose dentist-supervised at-home bleaching, which is more economical and provides similar results. If you don't choose laser bleaching, at your next appointment your dentist or hygienist will make impressions of your teeth to create a mouth guard appliance. The mouth guard is custom made for your mouth and is lightweight so that it can be worn comfortably while you are awake or sleeping. The mouth guard is so thin that you should even be able to talk and work while wearing it. Along with the mouth guard, you'll receive the bleaching materials. You'll be given instructions on how to wear the mouth guard. Question 13. How bleaching works and safety. Answer. Lightness should last from 1 to 5 years, depending on your personal habits such as smoking and drinking coffee and tea. At this point you may choose to get a touch-up. The retreatment time is much shorter than the original treatment time. The active ingredient in most of whitening agents is caramide peroxide. When water comes into contact with this white crystal, the release of hydrogen peroxide lightens the teeth. Several studies have proven bleaching to be safe and effective. The American Dental Association has granted its seal of approval to some tooth bleaching products. Some patients may experience slight gum irritation or tooth sensitivity, which will resolve when the treatment ends. Question 14. What is a composite resin white filling? Answer. A composite filling is a tooth-colored plastic and glass mixture used to restore decayed teeth. Composites are also used for cosmetic improvements of the smile by changing the color of the teeth or reshaping disfigured teeth. Question 15. How is a composite placed? Answer. Following preparation, the dentist places the composite in layers, typically using a light specialized to harden each layer. When the process is finished, the dentist will shape the composite to fit the tooth. The dentist then polishes the composite to prevent staining and early wear.